He's taking on the big shots and working hard to get you answers. 8 on your side, Steve Andrews investigates.
A terrible explosion at work leaves a Lakeland man badly injured. 17 months later, his nightmare with workers' comp continues. Neil Eckelberger wants to get well, but he's having a devil of a time trying to get the medical care he needs.
Neil is fighting with workers' compensation giant Travelers Indemnity Company. 8 on your side, senior investigative reporter Steve Andrews tells us that struggle started as soon as he was released from the hospital.
Yeah, you know, Neil, after his release from Tampa General Hospital, Travelers sent him to a walk-in clinic. Okay, a walk-in clinic. He's still struggling for treatment. Why? Tonight, documents show a workers' comp doctor provided false information to Travelers about Neil's condition. Somehow, while he was at work, Neil Eckelberger survived this. The September 2017 blast at Natural Advantage Food Flavorings in Lakeland left Neil with fire and chemical burns. He spent 10 days in Tampa General Hospital's burn unit undergoing painful grafts and debridement.
That's it, done.
Since then,
every day I have headaches.
Wife Robin.
Neil is very depressed.
Travelers Insurance sent Neil to workers' comp neurologist Dr. Thomas Newman. This is some of what Dr. Newman told Travelers. The patient denied insomnia. Where's that coming from?
I don't know. It floored me.
Dr. Newman added Neil denied depression, anxiety, light sensitivity.
Neil is laying on the table in there. He's complaining about the lights and his headaches, and he's not sleeping, and he's depressed, and he's angry.
Newman wrote, Neil denied blurred vision, hearing loss, and tinnitus.
The ringing never stops. I lost hearing in my left ear. Sometimes my vision will be blurry.
But according to Dr. Newman's reports to Travelers, Neil had none of that. Neil's attorney is Michael Weiner.
In terms of the neurologist, almost all of his revenues and patients come from workers' compensation.
Michael Weiner claims the doctor did not accurately chart complaints and provided false and misleading information to Travelers, which allowed it to deny Neil benefits.
And it doesn't make sense. If you're a neurologist and someone is not really complaining, why are you filling 3 prescription bottles every visit?
Like this? These are the medications that Dr. Newman and workers' comp psychiatrist Kirti Pandya prescribed for Neil for sleeping, anxiety, depression, muscle spasms, pain.
It's one of two things, right? Either they're lying about me saying that I didn't have those symptoms, or they're fraudulently prescribing drugs to somebody that doesn't need them.
Now, Dr. Newman recommended pain management for Neil in July, then changed his mind. In November, he recommended pain management again, which Travelers has yet to authorize. And Dr. Newman has not responded to my request for a comment. You know, everything about this case just screams workers' comp reform.
Yeah, there's been a failure here, it seems. Travelers is telling you that they've gone to great lengths to ensure that this guy's getting the proper treatment, everything he needs. They're going above and beyond.
Right.
How are they doing that?
Well, they're not really telling me how they're doing that. Now, Travelers claims that Mr. Eckelberger's attorney won't grant permission to discuss specifics of this case, but Michael Weiner counters that Travelers is free to discuss the reasons it's doing what it's doing, just not Neil's private confidential health information.
So
This
here we
one's
are.
perplexing.
All right.
Yep.
Thank you, Steve. If you have a problem you want Steve to investigate, give him a call. The 8 on your side helpline is on your screen right now, 1-800-338-0808.